Before discussing eGFR, let us find out what a glomerulus is and its functions. The renal artery enters the kidneys and forms tiny clusters of looping blood vessels. Each group is called the glomerulus. There are approximately 1 million glomeruli or filters in each kidney. Each kidney is made up of about 1 million filtering units called nephrons. Each nephron includes a filter called the glomerulus and tubules. The primary function of the glomerulus is to filter plasma to produce glomerular filtrate, which passes down the length of the nephron tubules to form urine. Blood enters each glomerulus, filters the unwanted waste products, ions and glucose into the urine, and the pure blood returns to the circulation. The glomerular filtration rate measurement comes from the name of the filtering units inside your kidneys, called the glomeruli as mentioned. What is filtered from the blood during glomerular filtration? The main waste products that are filtered in the kidneys from the blood are urea. Other materials eliminated via the kidneys include the nitrogenous waste products like ammonia, uric acid, urea, creatinine, creatine, sodium, potassium, and amino acids. Excess quantities of salt and water that may be taken into the body. If your kidneys are not functioning efficiently, these waste products can accumulate in your blood and make your life most miserable. Now let us discuss about glomerular filtration rate or eGFR. Glomerular filtration rate is used to check how well the kidneys work, that is the urine formation. Especially, it estimates how much blood passes through the glomeruli each minute. Glomeruli are the tiny filters in the kidneys that forms part of the nephron that filters waste from the blood as mentioned before. Each kidney is made up of about 1 million filtering units called nephrons as mentioned before. Each nephron includes a filter called the glomerulus and a tubule. The nephrons work through a two-step process. The glomerulus filters your blood and the tubule returns needed substances to your blood and removes waste. What is the relation between creatinine and GFR? A normal eGFR should reach 60 or more. If your eGFR is less than 60 for 3 months or more, your kidneys may not be working well. Creatinine is a waste from normal wear and tear on the body's muscles. Everyone has creatinine in their bloodstream. What happens if creatinine is high? High creatinine levels in the blood or urine indicates that the kidneys are not effectively filtering the blood. Creatinine levels are not life-threatening but may indicate a severe health issue such as chronic kidney disease. A routine blood test can measure creatinine levels in your blood. Factors that raise your creatinine levels include certain medications, including some antibiotics and non-steroid anti-inflammatory drugs or NSAIDs, creatinine supplements. Dietary factors such as high intake of protein, strenuous exercise, impaired kidney function, low blood flow to the kidney as in renal artery stenosis, dehydration. If you do vigorous exercise, avoid it for 24 hours before a creatinine blood test. According to a 2014 study, eating red meat may increase creatinine levels. Red meat is muscle tissue which naturally contains creatine, and cooking causes the creatine to break down into creatinine. When a person eats the meat, their body absorbs the creatinine and their levels may rise. Eating less red meat and fewer fish products may reduce high creatinine levels. A person might try incorporating more vegetable protein sources such as beans, into their diet. If the glomerulus, the part of the kidney that filters waste, is damaged or otherwise not working efficiently, a person may have high levels of creatinine in the blood but low levels in the urine. This indicates that the kidneys are not functioning optimally. Diseases that can affect kidney functions and raise creatinine levels include diabetes, tumors, some infections such as hepatitis B, C, HIV, and syphilis. Systemic lupus erythematosus is sometimes called SLE or just lupus. A doctor will recommend treatment if a person has high creatinine levels due to a kidney disorder. Diet and lifestyle changes may also help. eGFR declines with age. eGFR gets lower with age, even in people without kidney disease. The older you are, the lower your eGFR. The eGFR calculation accounts for the period. At any age, an eGFR below 60 for 3 months or more indicates kidney disease, as mentioned earlier. However, we know that eGFR physiologically decreases with age, and in adults older than 70 years, the values below 60 milliliters per minute could be considered normal. How fast can eGFR drop? The average drop in the estimated glomerular filtration rate, or eGFR, is about 1 cc per minute per 1.73 meters squared yearly, based on natural aging. Patients with some forms of kidney disease such as diabetes and glomerulonephritis can drop by 5 to 10 per year. Can you reverse eGFR? If the decrease in the estimated glomerular filtrate rate, or eGFR, is due to acute kidney injury with a sudden reduction in kidney function, this can commonly be reversed. If the disease is due to chronic kidney disease, or CKD, the recovery of eGFR is usually not possible. How can you control eGFR? Follow a low-salt diet. Salt should be limited, especially if you have high blood pressure, protein in your urine, swelling or difficulty in breathing. Eating less than 2000 milligrams a day of sodium is recommended. Controlling blood pressure is essential. You can manage high blood pressure through exercise, diet, stress reduction, and limiting alcohol, among other lifestyle choices. Make sure you are not deficient in vitamin D. Metabolic conditions such as diabetes, among others. How is it tested? Estimated glomerular filtration, or eGFR, is calculated using serum creatinine and other factors such as age, race, and gender. The blood sample is sent to a laboratory. There, the creatinine level in the blood sample is tested. Creatinine is a chemical waste product of creatine. Creatine is the body's chemical to supply energy, mainly to muscles. The lab specialists combine your blood creatinine level with several other factors to estimate your eGFR. Different formulas are used for adults and children. The formula includes some or all of the following: age, blood creatinine measurement, ethnicity, sex, height, weight. The creatinine clearance test, which involves a 24-hour urine collection, can also estimate kidney function. Hello viewers, this video talk on eGFR may be a bit confusing, but what you should take home is that it is an important test to check your kidney health. Could you not allow it to drop too fast? When it falls less than 15, you may need dialysis to remove the waste products mentioned from your kidneys. Exercise daily. Keep your blood pressure within the normal range. Enjoy a vegetable-based low-salt diet. Drink plenty of water daily and control your diabetes to maintain good kidney functions. Get your doctor to do blood creatinine levels in your blood and an eGFR test to assess the state of your kidneys annually. Please stay safe and goodbye until we meet again.